City was my first back in 2023, and then I did Berlin, Chicago, Boston, and London, and I'm returning for Boston again this year.
On the surface, Erica Rasmussen may sound like your traditional marathoner, but her journey to the 130th Boston Marathon has been anything but. Having struggled with obesity, Rasmussen says it was her complicated pregnancy that motivated her to take her health seriously and pick up running.
I said, okay, like when I have this healthy baby, I'm gonna make a change for myself and my family.
She started participating in 5Ks before taking the leap to marathons, but the fun run only lasted so long.
I didn't know it, but I was actually running with an abdominal tumor. And fortunately, it was just abdominal endometriosis. And with that, I had open surgery last August.
Following her abdominal surgery, she says she slowly got back to training for her second Boston Marathon until a hip pain started creeping in.
It turned out that I need hip reconstruction surgery next month, so I'm running Boston to the best of my ability.
Since January, she's adjusted her training by picking up stationary biking to safely complete what will be her last marathon.
Like my hip surgeon said, he goes, you know, I don't think that, 26 more miles is going to be too hard on you, so you can do it, and then that's it for distance running.
She says for her, Monday is not about winning first place, but about showing her two young kids the power of determination and grit, and hopefully inspire others.
I'm going to pace with grace on Monday, give it my all, and really just have fun.
Lucky for Rasmussen, her family will be cheering her on every step of the way.
Go, Mom! Go, Mom!
In Cromwell, Jennifer Cuevas, NBC, Connecticut News.
And we are joined this morning by Miss Erica Rasmussen live in Boston as she gets ready to run now her second Boston Marathon. And you say final. I hear what your doctor says, but we'll see if you're really done with long distance after this. Erica, thanks for joining us. I know you live in Colorado, even though you're in Boston for the race, yes?
Yes, I live in Gunnison.
Well, welcome to the show this morning and congratulations. I know it's a big day. It's probably also an overwhelming day. How are you feeling with your training? I know it's very different as you kind of work on that hip before surgery, but how is it feeling looking ahead to Monday for you?
I'm just excited. I've spent a lot of time on a stationary bike, and I've never been a stationary bike or treadmill person, just staying in place. But that's what I had to do to get to the start line on Monday. And honestly, I'm just excited at this point.
Now, first of all, cross-training is very important, right? We'll just look at it as cross-training for your marathon.
Correct.
This is not your first Boston, and certainly not your first marathon. How many marathons have you finished now?
This is the 6th marathon that I'll be finishing on Monday. So
wow.
Can't tell, I'm a little determined. No matter what, I'm crossing that finish line, even if I'm the last one.
You're getting there, girl. You're getting there. Can you believe you've done that many now, looking back on your health journey and everything you've overcome and just how your health has changed over the years? That seems so wild.
Yeah, actually, I was at that last story, my kids were at the track with me, and that was the same track that I struggled running the mile fitness test as a kid. Mm-hmm. And I said to my kids, if someone told me 20 years ago that I would be running marathons all over the world, I would have laughed at them and not believed them. But here we are.
Here we are. Now, your story is really an inspiring one for a lot of other runners because, Colorado is a very fit state. A lot of people here are runners, bikers, what have you. What do you think you would hope your message is for people who may not be a traditional runner or coming to running late in life or working through a health journey? What do you hope they get out of your story?
Really the power of grit and determination. Ultimately, baby steps will get us where we want to go if we stay persistent and intentional and don't give up. I easily could have given up in January when my physician, we're lucky in the Gunnison Valley to have amazing orthopedics. My doctor, Dr. Beam, was about to go to the Olympics as the head Team USA doctor, and she made time in her schedule to figure out what was going on with my hip, and she goes, let's get you to this marathon. And, determination and surrounding yourself with people that believe in you so you can believe in yourself more is huge.
So you've finished Boston before. You've been across that finish line, Boylston, the emotions of that. How do you think it'll feel Monday when you get there? How are you thinking about that moment?
This is the first marathon that my kids have ever seen, and so they will be there at the finish line along with my husband, and I'll have family and friends along the race route, and that energy is just building. Even if I finish again last, it's okay. I'm just determined to go 26.2 and finish strong, and I am really, really excited.
And before we let you go, you have been raising money as well, doing this, trying to help other folks. Tell me really quickly about what you're trying to also impact in this race to the finish line.
Yes, so every marathon I've run for charity, and so I've raised over 30 grand for charity, and I'm almost at 10 grand for Boston Medical Center, helping improve wellness in Boston and beyond. And I had over 110 donors, mainly from Gunnison area, a lot of friends and family and coworkers, and it really, the power of so many people behind this journey, it's not just me. I'm running for every single person that's been cheering me on.
All right. Well, Erica, best of luck to you. We'll all be cheering you as well as all the other racers that morning. And I'm sure there are many from Colorado making the trip to Boston. So have so much fun. Good luck, and good luck with your surgery afterward, too.
Thank you.
All right. Thank you for coming on today.